Hello everybody and welcome to Jeff the Pharmacist. I want to thank you guys for tuning in. Today I want to talk about a very thorny and depressing and sad issue, and that is the current opiate crisis. So right now we have an epidemic in drug overdose deaths. Most of them are related to opiates. So opiates are basically pain medication like oxycodone, OxyContin, hydromorphone, Percocet, and also an opiate would be heroin. So heroin is closely related to a pain medication called morphine. So morphine and heroin are very, very similar drugs. So if you think oxycodone, OxyContin, there's basically an equivalent amount of oxycodone that you could take that would make you feel like you had just taken heroin. So it's very, very similar. So I kind of wanted to tackle the issue. So just looking at it as far as the United States, in 2016, 60,000 people succumbed to overdoses in the United States. Most of those were related to opiates. So it's incredible to think about that in 1 year we had more Americans killed by drug overdoses than died in the entire Vietnam War. So it's incredibly sad. There are medical examiners that are running out of space in their freezers. They're having to get semi-trailers for cold storage to put bodies in. It's a really disgusting and a sad thing that's occurring in this great country. So for me as a pharmacist, it's very frustrating because if you think about it, we're dispensing pain medication, and we're doing that in order to help patients to make their quality of life better, to improve their situation. And it's kind of sad for us to think, okay, we're giving this pain medication to people, and it might be harming them or killing them. So drug addiction is very complicated. There is a lot of terms that are thrown out. There's dependence, which is something that occurs naturally if you're on pain medication. If you continue to take it for a while, your body will become dependent on that. That's a kind of a normal process. And then there is something called drug addiction, which is also psychological. That is, people just want the high, or they want to get that feeling again. So being a pharmacist right now in kind of the midst of the opiate epidemic, it's very frustrating to be kind of on the front lines. We're not supposed to really judge people when they come in. You can't really just judge them. You're supposed to take the prescription and basically try to gather as much information as you need to make a professional decision to dispense the medication. Though there are some things that occur that are just kind of anecdotal that I thought I would mention. Sometimes, this has occurred to me a couple times, I'll see somebody kind of walking towards the pharmacy, and they've got like a normal gait. So they're just kind of walking normally towards the pharmacy, and they get about like 10 feet away, and they start dragging one of their legs. I mean, so we're not supposed to judge, but stuff like that makes you a little suspicious. So opiates are a huge industry. So if you think about it, you have pain doctors and pain clinics, you have pharmacies, you have drug companies. The most popular extended release drug, one of the most popular extended release drugs, certainly the one that is the most profitable, is not for us but for drug companies, is called OxyContin. So a little bottle of 100 tablets is over $1,000 for OxyContin. So it's incredible, and the reason that that is prescribed so much is because it's crush resistant. So it deters people from crushing it and dissolving it in something and injecting it into their bodies. So that's why it's so popular. But it's also very profitable for the drug companies. So there's been some people that are hypothesizing that part of the drug epidemic now is because of profit taking or a profit motive from drug companies. I don't know if that's true or not. It could be part of it. What I did see in my research was some people are pointing to a letter written to the New England Journal of Medicine as kind of the beginning of this change in attitude toward being less permissive of pain management to being more permissive of it. So doctors prior to 1980 were very reluctant to give out pain medication. They started to warm up to it in the 80s and 90s, and people are pointing to a letter, a little letter. I'll show you. It's a paragraph. In the New England Journal of Medicine, it reads, so this is from a Dr. Herschel Jick, and he wrote, New England Journal of Medicine, recently we examined our current files to determine the incidence of narcotic addiction in 39,946 hospitalized medical patients who are monitored consecutively. Although there were 11,882 patients who received at least one narcotic preparation, there were only 4 cases of reasonably well-documented addiction in patients who had no history of addiction. The addiction was considered major in only 1 instance. The drug implicated were meperidine in 2 patients, Percodan in 1, and hydromorphone in 1. We conclude that despite widespread use of narcotic drugs in hospitals, the development of addiction is rare in medical patients with no history of addiction. So I don't know exactly what Dr. Jick was trying to say here, but what he was looking at was short-term hospital stays and addiction as a result of that. That's all. But this was used as a jumping off point to promote the use of pain management, chronic pain management in patients, and it was cited in over 600 papers about the treatment of pain, and was even used as advertisement by drug companies to medical professionals, mostly doctors. So one could draw a conclusion that people that are treated with pain management drugs, it's very rare for them to become addicted, become psychologically addicted to medication. This kind of led to a trend in the 1990s, pushed kind of by the American Pain Society, of treating pain as the 5th vital sign. So that is really being aggressive about pain treatment. So that's kind of the basis, the foundation, and that may be the foundation of the opiate epidemic. NPR caught up with Dr. Jick to ask him about the letter and his opinion on the role that the letter had in the opiate crisis. So NPR writes, inaccurate representations of that 1980 letter led to a dramatic increase in the prescribing of opioids for chronic pain. According to an article published this month in the same journal, the New England Journal of Medicine, by Dr. David Gerlink out of Toronto, who researches drug safety. So as I said before, he and his co-authors found more than 600 citations of a letter like that, a paragraph. A majority of which failed to note that the patients whom Jick and Porter described were in hospitals for brief stays when prescribed opioids. Some of the citations grossly misrepresented the conclusion of the letter. So Jick says that when the letter was published, it was not consequential at all. Only years later, he found that that letter was being used as advertisement by drug companies to push pain medication like OxyContin. And he said none of the companies ever talked to him about it. And I can show you a kind of a sample of an ad that would be showed to doctors at, say, a conference.
There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things. Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%. They don't wear out, they go on working. They do not have serious medical side effects. And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
So NPR asked Dr. Jick about the letter and they asked him if he regrets it. He says, the answer is fundamentally sure. The letter wasn't of value to health and medicine in and of itself, so if I could take it back, if I knew then what I know now, I would never have published it. It wasn't worth it. So looking back, so in the 1990s, pain was treated as a fifth vital sign, and the message to doctors was to treat pain. So that was the message. It's very unlikely to have this kind of addiction side effect. So I think the medical community needs to re-examine their stance on pain management. Now I don't know the answer really. You know, if history is a judge, it'll probably go way the other way, where people aren't even getting pain medications when they're coming out of surgery. So if you're going into surgery, you obviously have pain after the surgery. I think it's reasonable to treat that pain. You know, you have your wisdom teeth extracted. You're gonna have pain. It's reasonable to have pain medicine after that. So I hope it doesn't go the other way, where doctors are just not gonna write for pain medicine. They're gonna say, take 4 ibuprofen, take some Tylenol, and just call it a day from there, and we're not gonna treat the pain anymore. I kind of think that might be where it goes. I hope it doesn't. I hope we can find kind of a middle ground. I hope I hope that we can kind of stop what has started, this craziness that has started with a Vietnam War every year in terms of fatalities on the American side, of course. So I think the medical community needs to re-examine, and is re-examining its stance on the use of opioids. I hope that prescribers don't go too far the other direction, where you're coming out of surgery, you're having a lot of pain, and it's not being treated at all. I hope there is a middle ground that is reached. I know just from being in the community, I know that there's a tremendous amount of abuse out there. I hope we can cull that abuse without harming patients who really, really need, and there are legitimate uses for chronic pain management. So I hope you guys found this useful. If you did, please subscribe, because it would really help me out a lot and come up with kind of new and interesting content. I want to thank you guys for watching Jeff the Pharmacist. Thanks a lot.